Today we're talking all about the acronym B.R.A.I.N.S and how it can be helpful in your pregnancy and labor, and then how we can also use our brains in pregnancy and labor for true informed consent. So let's get into it. If you didn't already know me, my name is Julia. I'm a birth doula and hypnobirthing educator, and I created this channel to encourage women to learn about their bodies and have more positive birth experiences. As you progress throughout your pregnancy, maybe you get to the third trimester, you're having those weekly visits with your provider. They might start asking you about birth plan, what your preferences are, what type of birth do you want? And I think it's really important to go in with questions to have, but also the right questions. And the acronym B.R.A.I.N.S can really help with that. So what is this acronym and what do they stand for? First, it's brains. My brain just turned off. Benefits, risks, alternatives, intuition, nothing, and space. Every intervention is offered for a reason, and your provider likely thinks that it will help in some way. But make sure that you get clear on what the benefit actually is and figure out if the benefit is actually something that supports your birth goals. Ask what the benefits of the procedure, the medication, or the recommendation that your provider is offering you. Ask what some of the benefits of doing this right now. In labor, does it speed things up? Does it slow things down? Does it prevent a serious complication? Why are you being offered this? What are the risks? There is no intervention that is risk-free. Even something as simple as IV fluids or a cervical check, they all have risks to them, but do you know what they are? So ask, what are the risks for you, for your baby, and for your birth experience? This could include side effects or the cascade of further interventions. It could be emotional or psychological effects, like feeling out of control or disconnected from your body. And then moving on to alternatives, which is such an important question that I think often gets overlooked. Ask if there are any alternatives and if you can try something else first. Let's say, for example, your provider wants to start you on an induction and wants to have you on Pitocin right away. Maybe you can ask, what are the alternatives? And they share that you can have a Foley balloon inserted, and then you get to go home and start the induction at home and then come in. Did you even know that that was a possibility? And that an induction could be like that. And just asking a simple question can get you that other option. And next is intuition. This is your gut check. What does it feel like in your body? Even if it looks like all the benefits are great, how is it actually living in your body? What is your gut telling you? Are you feeling tense or maybe pressured? Or are you feeling calm and clear? Your body is intelligent and will often tell you what it needs. Ask yourself if this decision feels aligned with what you want, but give yourself the time and space to actually figure that out. And if nothing comes up, that's okay too. That's really where the next letter comes in. N, nothing. What if we do nothing? Barring all true medical emergency, what if you are given the time to figure it out? There's usually time. Labor often takes a while, especially for first time moms. Now, I'm not saying always, but usually you can say, can I have 20 minutes? Can I have 30 minutes? Can you step out of the room so that I don't feel pressured or feel like someone's hovering over me to actually figure out, what is my intuition saying? And sometimes doing nothing is actually doing a lot. But having the space to do that nothing, or to have that time to think, to not feel pressured, to not feel like someone's hovering you or is even going to judge you in the decision that you're making. This is your birth, your body, your baby. You get to decide what it is that you want, and you deserve the space and autonomy to do that. Space lets our nervous system settle a little bit. If you've been doing yoga or meditation, visualization, anything like that, use this space to really down-regulate your nervous system. So you're not making the decision in a heightened emotional state, but you're making it well-regulated. Because informed consent is so important. Do you actually understand what's being suggested? Is it just a bunch of garbled nonsense to you? Do you really actually understand it? Do you understand the benefits and the risks? Do you know what the options are? Are there alternatives? And does it feel aligned with you? Does it feel right for you without feeling pressured or judged or guilted into it? Sometimes that looks like asking your provider to dumb it down. I hate to use that language, but maybe ask them to simplify it. Thank you so much for sharing with me, but I really don't have a grasp on this, or I'm feeling really nervous right now and I just need you to expand a little bit for me. Asking those simple questions and getting the information to actually make you feel settled. You don't have to know everything and you don't have to be perfect, but you do have the opportunity to ask questions, to ask, help me understand, or say, not yet, or not right now. Now, if you're watching this and thinking, there's no way I could say this, I want to be confident, but I'm just like, I can't ask these questions. That is okay. Maybe you practice. Practice with your husband, your partner, your mom. Start asking questions. And maybe if you're really struggling with verbalizing what it is you want, consider hiring a doula so that they can be the advocate for you in the birth space so that you can just really let go and not have to think about advocating for yourself too much. You want to dig deeper and learn more about your options and how you can use the acronym BRAINS in your pregnancy and labor. I've created the pregnancy prep packet, which you can find at the link in the description box below. That's all for me today. Please like, comment, and subscribe, and I'll see you in my next video. Bye, guys.